I got a request from somebody asking about how to determine the pelvic analysis or misalignment without an x-ray, without a full spine or without any imaging. And so I'd like to go over that today. The first thing is, regardless with or without the film, you know, before I even go to the film, I'm going to be doing this analysis, and hopefully that what I find on the pelvis is going to match with an x-ray. So let's just say we don't have an x-ray today and we want to check the pelvis. So the first thing is the visual. So when we look at it visually, first thing is the dimples. And when we look at the bottoms of the dimples are representative of the PSIS, or the posterior superior iliac spine. And you can see that the right side is a little bit higher than the left side. What I want you to remember is that the pelvis or the sacroiliac joint is an auricular surface. What does that mean? It has this particular shape, okay? So it just doesn't go up and down and side to side. It follows the contour of the shape of that joint. Based on the auricular surface of the sacroiliac joint, there are particular ways it's going to misalign. And when you look at the pelvis, it sits like this. It can misalign up, anterior superior, or AS. It can misalign down, posterior inferior. And remember, as I said, when it goes up, it goes in slightly. When it comes down, it goes out slightly. Now, when I'm referencing the misalignment, we're referencing the position of the PSIS to the sacrum. So it can go AS, ASIN. It can go PI. It can go PIEX. It can go ASEX. It can go PIIN. The first thing is static palpation. Let's look and feel along with visually. So we know we can feel that the right PSIS is slightly higher than the left. As we're palpating along here, we're just feeling the resiliency of the tissues. And it feels a little boggier down at the bottom here. Is that tender at all, patient? Yeah. So that's one other finding. So we know that the dimple is higher, a potential AS, or maybe this is PI. If it goes AS, then the swelling is going to be on the bottom of the joint. If the swelling is on the top and the pointenderness on the top, it's usually indicative of a PI pelvis. Okay, so palpating the right sacroiliac joint, bottom right feels swollen, little tender. On the left side, there's some tight fibers, but nothing really sharp in there, correct? Yeah. Okay. Now, patient, scoot forward, please. Feet together, and I want, with your feet touching, I want you to open and close your knees, please. And we're getting the butterfly effect. We're getting general motion at the SI joints. Left side only. Now when she does the left, you can see the whole right side moves with it, okay, because it's stuck on the right. When she moves the right side only, the left wants to go with it also, not as much, okay? Scoot back for me, please. So we know there's some general fixation on the right joint. So we're going to go ahead and do motion palpation of the SI joint now. Top of the joint, middle of the joint, bottom of the joint. So as we're doing that, we're feeling it down in bottom right side. It's not really moving down here. That hurts down there? A little bit. A little bit, yeah? Okay. Let's go ahead and motion palpate this side. Top of the joint, middle of the joint, bottom of the joint. So we have fixation on the right SI joint. We have the PSIS that's gone higher than the left. We have swelling, fixation, and point tenderness on the bottom part of the PSIS. Next, we're going to check the gluteal folds. For the gluteal folds, if it's gone AS, it's going to raise the glute on that side. If it's dropped PI, it's going to lower the glute on that side. So let's look at the glute folds. And you can see right side is higher than the left side. This side is higher than this. Next, when we look from the top, we can see that the right side is flatter than the left side. So that indicates what? It's gone AS, IN, causing a little bit of a flatter glute on that side and a higher glute on that side. So AS, IN, okay? Typically with an ASIN, it's also going to cause an external foot flare. You could have an external foot flare. She doesn't, because she actually has internal rotation of the femur external rotation of the tibia, and that's also now that her body is compensating and presenting with a pronation issue. March in place. Knees up a little higher. There you go. So what I want you to notice is how those dimples are moving. Slow it down. Now stop. Raise your left leg and down. Raise your right leg and down. Left leg and down. So everything is kind of pointing to this right SI joint as an ASIN. So we're going to set it as an ASIN, and then we're going to retest and see what happens. 2 inches lateral, 3 inches inferior. That should be tender. Yes? Mm-hmm. So we're going to bring it down and out. Okay? Mm-hmm. Stole my thunder. All good. Walk it off. Come back over here and have a seat. Let's test it on the motion palpation. So first thing is, let's look at the bottom of the dimples. Okay, that's already different.
Yeah.
Now let's motion palpate. Ha 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 ha, it's moving. You feel that? Mm-hmm. Is it more or less tender now?
Less. I don't feel it.
You don't feel it? Through visualization, static and motion palpation, and gait analysis, we can still determine pelvic misalignment and help the patient without a film.